Okay, it says we are live. So it looks like if I don't know if since you're the top part of the presentation, Margaret, if you want to talk about kind of your chapters and your idea on that first.
Sure. So for the part about using the A-Day model for social justice and how we should address it, what kind of issue or framework we should address that with, I chose chapter 7, the community-based collaborative action and research. Because as nurses, we should be change agents and incorporate health equity in everything that we do. And I felt like this chapter in the textbook incorporates what we wanted to accomplish with our topic. So we can help bridge the gap.
Caitlin?
Yeah?
Can you try muting yourself to see?
Yeah, I don't know why it's not. I have my earphones in and it's working, but yeah, I'll mute it while I'm listening.
Or maybe it's us. Might be me. I don't know.
Okay, Margaret, I think if you want to go ahead.
So I like the community collaborative action research because I feel like it addresses the social justice issue that we've chosen for our topic, and that nurses should utilize evidence-based practice to create policy reformation to help bridge gaps in social determinants of health in vulnerable populations, which is what we are addressing with obesity in Texas. So nurses are the conduit to help free vulnerable populations, but they also are the conduit to help bring together policymakers, social justice advocates to help demarginalize vulnerable populations and help ensure that health equity is a priority. So that's one of the chapters that I really enjoyed of the textbook, and that's the chapter that I chose to help fulfill the topic presentation.
I looked at chapter 1 and chapter 18, but I feel like kind of one kind of went along with some of the things that you had in 7 with like the health equality and like and equity and stuff, and how nurses are, we're constantly using that and going along with that. And so I felt like that was kind of interesting. Chapter 18, I didn't feel like necessarily attributed very much to our actual project. It was more like talking about how social justice can dehumanize impacts of health and well-being, and about how like nurses need to like be more vocal and like to institute like change and stuff, and for like their full potential, and that it was kind of can be more dehumanizing. And so I didn't feel like that one went very well with ours. So I definitely feel like there was some stuff in chapter 1, but chapter 7, like you had, I feel like had a lot more that related to our project at least.
Yeah, and the collaborative aspect of it, because working with communities in my previous experience, it takes a village to keep the whole community safe, and it takes a collaborative effort, and you need a variety of different disciplines. And nursing is like that's the beauty of being a nurse, is that, and especially a nurse practitioner, is that you're the true conduit to help alleviate some of that. What's the word, I guess? But you're just the actual person who can coordinate and collaborate, corroborate, and get things done, because you understand the health issue at hand, but you also understand that it takes more than just health to make people healthy. It takes more. It takes policy, it takes processes, it takes individuals, public health, everything to bring things together. Store owners to have better, healthy food options for people. So that's why I like chapter 7. The other chapter that I really liked too, I think, was chapter compassion, chapter 3, compassion, biopower, and nursing. But I didn't reference it. But it's really good too, because as a nurse, we should exhibit compassion at all times with our patients, although it's difficult sometimes. So that nursing is here. We're supposed to be the advocate. Anyone else? Hello?
Yes.
Hi,
I
the red chapter. Or
go ahead,
Nancy.
Kathleen. No, you go ahead first, Kathleen. I don't mind. I'm good.
Okay. So I read chapter 7 as well and liked the collaborative aspect of it. But then I actually have the philosophies and theories books that Tori mentions in the module. So I went back and read chapter 7 of that philosophy and theory, and it's about critical theory and emancipatory knowing. And that's where I was getting the reference for the underpinning theory presentations. So I went with critical social theory, which is basically looking at society, seeing different class people, and people can be classified in all sorts of different ways. Looking differences or social disparities, and then doing a whole analysis to causes of those differences. So that's she was talking about how that's the theory that they're really implicitly in chapter 7 of our.
Yeah, that's
where I went. Go ahead.
Oh, go ahead.
No, I was just saying it works well with our health ad. We're looking for a solution that matches the problem, so we have to have that critical thinking piece of it. Did I cut you off, Margaret?
Oh, no, I was waiting. I'm sorry. No, because
No, go ahead.
In chapter 7, they talked about the emancipatory process that nurses have. So it's interesting that your topic was the same. I like that.
Well together.
Mm-hmm.
I think chapter 7 was a good choice. The chapter that I'd read initially was chapter 5. And while I liked it and it was an easy read, I think that the gist of what it was talking about, basically, she started off referring back to the state of our country prior to 9/11 and the way we felt safe and impermeable boundaries. Basically, we didn't feel like anyone could touch us, or we just felt like we were in a secure place. And the things that we learned as a society after the events that took place on 9/11, and the four things that she made reference to in this chapter had to do with omniscience, immortality, omnipotence, and safety. With omniscience, of course, being, if you have all of the information, then you would understand everything, and you'd be able to make the right decisions based off of that. And then, of course, immortality is, feeling like nothing can harm you or hurt you. And then the omnipotence being having more power. And then, of course, safety. And the last comment that she made in the chapter, I really liked it. Had to do with, she says, but I would suggest that we also share real time and space with the other, or real time and space to create healing and to strengthen the potential for health and well-being, even in the face of threat, danger, and illusion. And I think she's talking about us as nursing, in the field of nursing, having that ability to create that space for healing, and to kind of bridge that gap between the reality of what is and the reality of what we feel. So it was interesting. I like the chapter, but I think that probably chapter 7 probably pertains more to what we're trying to do in the paper. I mean, in the PowerPoint.
That's some interesting concepts, though.
Yeah. I like that, Nancy.
I
like
do too. Mm-hmm.
I think this book is really good. I wish I had more time to read the whole thing, because I think the stories within it are an easy read. So it's a good book.
It is a good book. I'm going to keep it. I like it.
Yeah,
I like your thinking.
Perfect. Well, any other questions about that?
I don't think so.
No.
I don't know. I had a few questions on my PowerPoint slide. There's a couple things I wanted to ask you ladies quick. I sent you guys an email if you'll look at that really quick. But then, so the first question I had on my winners and losers slide is that I'm having a hard time finding actual, like, it's like who gains, who and loses, and like who bears the potential solutions. I found like a couple sources on the actual like potential bears the cost of the solutions. But as far as the actual like gains and losses, it was kind of just something that I inferred from like that Medicaid will first see an increase in cost if they're starting to pay for more weight loss counseling, but that if that eventually it would decrease the overall cost, but I'm not going to necessarily find evidence on that, like per se 100% saying that. And so I didn't know what you guys thought about, that, if that's kind of what it should be. That's kind of what I was thinking. Like, obviously this is like our idea of what would happen if we made this policy. So I don't know if that makes sense. Like, I found some for like who would bear the potential costs and some references on that, but not necessarily everything on the winners and losers portion of that. Does that make sense?
So if we keep it simple, like obviously the winners from weight loss is the patient.
Mm-hmm.
And then a winner, I mean, Medicaid can be a winner in this, like you said, if the end result is a reduction in healthcare costs,
Mm-hmm.
because we're reducing the associated more costly health outcomes.
Exactly.
Mm-hmm.
And so in that situation, it definitely would mean, obviously patients a winner and the Medicaid system's a winner.
Mm-hmm.
But Medicaid can also be a loser too.
When I was
Go ahead.
in the BBB about, sorry, I talked to Tori about how like when will be the economy healthier.
Hey, you all.
Coming up through.
I'm so sorry, but I have to leave for a C-section. So I don't know if you guys will be back around in 30 minutes still working on things, if I can call you again, or you guys can just finish it. The only thing is, like, I'm doing the broadcasting, so I can see if my husband can sneak in to shut it off. I'm so sorry. Of course, this like never happens, and now it's my patient that went in that I have to do a C-section on. So, do you guys want to just continue without me, and then like I can see if my husband can come in and shut it off, so it's not like 8 hours long? Not that it would be that long. Or do you want me to try to call you guys back in like 30 minutes when I'm done?
I think you were the one
maybe
that had the question.
Okay. Because yeah, my only other question is that he just messaged me that they're taking her back in 2 to 3 minutes. So was like on slide, the last slide, I just put like the how would we approach developing and implementing this policy, and that we would talk to what do you call it? That Jane Nelson, because that's who we had addressed our what do you call it?
The letter to.
The letter to.
Letter.
I didn't know if you guys wanted me to be more general and say it to like all of like the centers, like, you know, like, and like the representatives for Texas, or just address it to her.
I think just address it to her.
Okay, because that was kind of my other question, which, like I said, obviously I still have to wrap up on mine, but that's kind of where I'm at there. But if you guys want to talk a little bit, I have to step away, but I can have my husband come in and stop the broadcasting. I'm so sorry.
That's
never
okay. You can
happens.
stop the
We
broadcast.
can leave you some comments
Yeah,
on the
good.
Google Doc.
Okay, do you want me to stop the broadcasting and then we can just finish up through email?
Yeah.
Okay, thanks, ladies.
Okay.
Bye.
Good night. Good luck.